This is a story that anyone who pays for healthcare insurance knows very well. The cost of health insurance goes up year after year. If you are employed, then chances are that the company that you work for pays for your healthcare premium each month. Business managers are very well aware that these costs are on the rise. A recent study shows that 82% of employers say that these costs are the number one impediment to growing their businesses. We all know that the price of healthcare is going up. A total cost of $2.91 trillion in 2014. The per capita cost has gone up dramatically over the past 10 years, but did you know that it will rise to 20% of the gross domestic product in the United States in 2015? Where does the money go? 84% of all healthcare spending simply goes to cover the costs of patients with chronic illnesses. A full 50% of all U.S. residents have one or more chronic illness. The definition of medication adherence is simply taking the medication that your doctor has prescribed for you, going to the pharmacy and getting it filled, and then taking it on time and in the correct amounts. Anything other than this is referred to as non-adherence. That's the issue that we need to tackle. Non-adherence is the factor that costs our nation 13% of the total spending on healthcare every year. That's a huge number. 70% of Americans have the need to take prescription medications, but 75% of those patients don't take them as prescribed by their doctor. And an astonishing 1/3 of all written prescriptions never ever get filled. The U.S. wastes more than $300 billion each year treating unnecessary medical complications that could have been avoided if patients had just taken their meds as prescribed. Medication non-adherence is the costliest health condition we face. In fact, curing non-adherence would cover the cost of health care for more than 44 million Americans. Better adherence leads to improved healthcare outcomes and decreased spending. In fact, the average savings for patients with chronic illness totals in the thousands of dollars per year. As an example, a patient who has congestive heart failure, who is adherent, has an annual average savings of almost $8,000, and patients who are non-adherent have estimated $2,000 of additional expense for unnecessary doctor's visits. Non-adherence contributes significantly to 20 million lost workdays every year, along with reduced job performance. People don't take their medications as prescribed because they may have some questions about their meds, or a financial consideration, but the overwhelming 69% is due just to forgetfulness or procrastination. These folks simply need a reminder. People who don't take their meds as prescribed drives up the cost of health care for everyone. Taking your meds on time matters when it comes to controlling the cost of health care every month, every year. Medtexter makes it easy, reminding you to take your meds on time, every time. Medtexter will help you manage your meds. You'll get alerts when it's time to take your meds and when it's time to refill your prescriptions. The system works on your smartphone, tablet, or computer. It works worldwide, and it's secure, protecting your and your family's personal information. Take control of your healthcare costs. Medtexter will keep an eye on your meds, allowing you to pay attention to the things that matter to you in your on-the-go life. It's easy. Medtexter reminds you to take your meds on time, every time, because taking your meds on time really does matter.